What drew you to naturopathic medicine?
It was actually a bit of an interesting story. It was athletics, and I was interested in improvement in athletic performance because after college I went and was doing triathlons just to keep myself fit. And I was working at a health food store. This was in Iowa City, Iowa. This was after I gained my BA in philosophy, of all things. So I had no formal exercise physiology training or really no science training at all. But what I did have was an interest in why people were coming into this health food store back in 1990 and 91, and how the products and the foods that they were buying were helping them. And I was interested in athletics myself, and I decided that I would try myself to see if I could improve, and became interested in that. Adjacent to that health food store were a suite of medical offices, which was directed by a gentleman named Dr. Philip Lansky, who became my original mentor. And interestingly enough, he's an MD and a PhD, but was an accomplished traditional Chinese medicine practitioner and constitutional homeopath.
Based on our survey, a majority of naturopaths feel they did not get the training they needed to enter the business of naturopathic medicine. Did you seek additional business education to begin your practice?
So I didn't, but I did not begin this business straight out of school. So I did have some indirect mentorship with one of the clinics that I worked for. I helped start the clinic up from scratch, and it was a cancer center. And it was a very interesting business model because most of our patients were from out of state and came and stayed there for many weeks to months at a time for treatment. And so there was an interesting business model in being able to sort of talk to the owner of the clinic about it. But when we started naturopathic specialists, my wife and I, we didn't have any formal business training or seek the additional help. It was based on our true belief in providing a quality product how we would want provision for ourselves and giving that to our patients. Making sure that when they left they had something that we could be proud of, and then putting together an administrative staff that believed in the same. Because if you look at our logo, personalized medicine, personalized care, the experience at a naturopathic medical center, and certainly the experience at any medical center, should be both about the medicine as well as the care. We truly believe that. And whereas the doctors give the medicine, it's facilitated throughout the whole clinic. And the care is so often given outside of the doctor's consultation office. It's given by the business as a whole. And we believe that the patient truly needs to feel cared for holistically. Not just holistically when you're sitting in front of the doctor, but there's a holistic holism about how you care for a patient. And that's what our practice is centered around.
Excellent. When you made the choice to open your practice, what were your biggest concerns?
Well, certainly the biggest concerns is, will people like you? Will you have a convenient location so they can have easy parking, find you easily, and be accessible? Because if you're not, people might give up if it's too frustrating to get to you in terms of traffic, or if parking is difficult, or the elevators don't work, or what have you. So location was a big issue and a big concern. And so we decided that part of the spirit of our practice in naturopathic medicine was to find a place in the larger medical community as a whole, that we are here and we fit in. And so we situated ourselves adjacent to a hospital, Scottsdale Osborne, and we are in Scottsdale Medical Pavilion, which is directly across the street from Scottsdale Osborne Hospital, which has a level 1 trauma unit. It's a big medical center here in Scottsdale. And I figured that it lended validity and believability to the practice of naturopathic medicine. So.
Now that you've achieved a level of success, what are your next goals?
The next goals are continuations of the goals that we've always had. For my part of the practice, which is naturopathic oncology, has really been a belief that every person diagnosed with cancer or wanting to prevent such should have the choice of naturopathic medicine or not. Doesn't mean they have to choose it. It just means that they should understand that the choice exists for them should they want it. So we continue. We've also wanted to help take the designation ND, naturopathic doctor, to places that it hasn't yet been before, to help expand the scope and breadth of naturopathic medicine. And we continue to do so. And we move on that front as sort of a syncytium, as a united whole in this clinic. Naturopathic specialists is about doctors of naturopathic medicine who have focus. And that's what we do, and we're able to care for many different patients with many different diagnoses because of that across our platform.
What advice would you give to students or new naturopaths to achieve success in natural medicine?
It's a great question. It's a big one. And as we know, naturopathic medicine is its own system of medicine, its own precepts, its own schools, its own medical boards. And staying true to the precepts of naturopathic medicine is what's created the survivability of the profession and the growth of it. The leaders in the profession, the leaders of the academic institutions, of our national association, of the state associations, of the medical boards for each licensed state, and the practitioners who continue to sort of pave the way, and those who support and come after them, all believe in the precepts of naturopathic medicine, and it's a chosen profession because they believe in their hearts that it is the way that they can help people. And holding true to that has to be, at ground level, the most important thing. And success will come from believing in those precepts and delivering a quality product and quality care to the patient. I don't think it can be any other way.
Thank you.